What does it mean, mean when the hospital chart says restricted range of motion? It was less than what I would feel is normal in someone of his age group. Do you have a measurement or a degree? I consider someone in their 40s should. The court, just a minute, let's not talk about someone in his 40s. The defendant's counsel, objection. The court, sustained. Let's talk about the plaintiff. Do you have an opinion within a reasonable amount of medical certainty of how restricted his motion was with respect to what you expected or what was normal? Would you repeat that? Withdrawn. When did you next see Mr. Nash? January of '04. What happened then? At this time, he was noted to have continued back pain. The rest of his neurologic exam was normal. What about the disc herniation? How was that done? I had a repeat URI or MRI performed before this. The disc herniation seemed to be progressing. I discussed that with and suggested that surgical intervention would be a good idea for him because of the length of time he had in pain. Do you happen to have the more recent films of the MRI? Yes, I do. Can you explain to the jury what you found? Is there a set of films that compares with the MRI? Yes, there is. Take a look. They are both in the folder. I won't recall due to the fact that it compares the two of them. Plaintiff's counsel, Your Honor, may I have this sheet up for the doctor's perusal? The court, if there is no objection. The defendant's counsel, I don't object. What film are we looking at? It's labeled read by Dr. Nash. What date does it bear? November 21st, 2003. The court, is it an exhibit in evidence? Plaintiff's counsel, yes, it is, Your Honor. Exhibit 5. Do you see anything significant on those films, Doctor? Actually, I wasn't aware in this folder that there is a comparison between the previous views of this patient's spine between 1998 and 2003. What does that show? They show on the sagittal views a small herniation. Has it changed at all, would you say? You really don't see the change as much on the sagittal side as on the axial view where it appears to be slightly larger. It would appear to be quite subtle. Does it mean anything to you medically? Medically, it's worsening over time. It is now starting to shift to one side, which is not unusual. Defendant's counsel, objection as not responsive. The court, overruled. Well, it seems to me that it is. Doctor, do you have an opinion with a reasonable degree of medical certainty whether or not Mr. Nash suffered a permanent consequential limitation of use of a body organ or member? Yes. What is your opinion? That he has ongoing back disease and this results in restriction of his motion and restriction of use. Defendant's counsel, Your Honor, I object. The court, overruled. Doctor, would that be permanent? Yes. Do you have an opinion within a reasonable degree of medical certainty whether or not Mr. Nash has sufficient limitation of a body function or system? Yes. What would your opinion be? Again, as I stated previously, he has ongoing back disease, which is not going to get any better, and by natural history, any experience, it will progress over the course of time. Let me ask you directly, Doctor, does Mr. Nash have a significantly limitation of use of a body function or system? Yes, he does. Does Mr. Nash also have a permanent consequential limitation of use of a body organ or member? The court, with a reasonable degree of medical certainty. Yes, he does. What part of his body would that be? The lumbar spine. Doctor, do you have an opinion within a reasonable degree of medical certainty whether or not Mr. Nash's injuries were approximately caused by the accident in question? Yes. What is your opinion? They were. Do you have an opinion whether these injuries are permanent? Yes. What is your opinion? They are permanent. Do you have an opinion within a reasonable degree of medical certainty what the future holds for Mr. Nash as far as his injuries are concerned to his cervical and lumbar spine? Yes. Defense counsel, object. The court overruled. What is your opinion, doctor? Again, through experience, not only my own, there will be changes consistent with osteoarthritis. It's hard to say at this time, symptom-wise, how much more he will have or to what extent his symptoms will be, but he certainly will have symptoms which will be present on at least an intermittent level. And will that cause pain? Yes, it will cause intermittent pain. Do you have an opinion, doctor, within a reasonable degree of medical certainty, what type of future care or treatment Mr. Nash will require? Defense counsel, Your Honor, I respectfully object. May we have a sidebar? The court, no. Doctor, do you have an opinion within a reasonable degree of medical certainty what the future holds for Mr. Nash with respect to the injuries that you described here today as far as care and treatment? Yes. What is that opinion, sir? It will depend upon his level of tolerance to pain and also the symptoms that he has. He may require injection therapy. What about future surgery? There is a strong possibility he will require surgery.